So, good morning, one and all. I am Dr. Malarvali. I am Assistant Professor in SRM Medical College, Katangalathur, and Consultant in Sugam Hospital, Krompet. My association with Shankar is from my PG days, and today he asked me to talk on ripple effects of obstructive sleep apnea. Basically, a summarization of the topics covered by the prior two speakers. So OSA, the definition you know, it's repetitive upper airway collapse during sleep. So AHI has been discussed and Bevono classification has been discussed. And what is the prevalence? It affects some millions in worldwide and often it's underdiagnosed. People think like a day of heavy work, snoring is normal. That's not the case. And the risk factors: obesity, male gender, large neck circumference, alcohol, sedatives, craniofacial anomalies. The common obstructive sleep apnea symptoms are loud snoring, difficulty concentrating, frequent nighttime urination, gasping or choking during sleep, which makes the person wake up with an interrupted sleep cycle, and morning headaches. So the first ripple effect is on the cardiovascular system. It's hypertension, especially resistant hypertension. You load the patient with antihypertensive, still the hypertension is not under control, and you have arrhythmias, coronary artery disease, and increased stroke risk. And OSA in cardiology, the pathophysiology is basically increased sympathetic tone leading to inflammation, metabolic dysregulation, which subsequently leads to intermittent hypoxia and associated oxidative stress and endothelial dysfunction, as discussed by the first speaker, Dr. Mohammed, and intrathoracic pressure swings. So this leads to subsequent intra-arterial hypertension, leading to heart failure, arterial fibrillation, ventricular arrhythmia, and sudden cardiac death. So the metabolic effect, metabolic health is the second ripple effect. So it's basically a conglomerate of all the effects over the end organ because of OSA. It's insulin resistance, type 2 diabetes mellitus, metabolic syndrome, and weight gain and difficulty with weight loss. So the first speaker spoke about how sleep is so important for us to recover from the day's stress. So it includes immune system and neurocognitive effect. So a proper sleep during night will have a proper effect on your next day. So if not, you will have daytime sleepiness, memory and concentration problems, depression and anxiety risk, and increased risk of motor vehicle accidents due to inadequate concentration on the next day. So you have a ripple effect on pulmonary and ENT consequences. I have just said ENT consequences because most of you here are colleagues, so you must know a lot more than me. So on pulmonary system, chronic intermittent hypoxia, pulmonary hypertension, and overlap with asthma and COPD. So the effect of cortisol increase and subsequently COPD has been discussed by the prior speakers. So ripple effect on sleep architecture and quality of life. So since OSA patients mostly have fragmented sleep and reduced REM sleep and deep sleep, they tend to have a daytime fatigue perennially, which leads to low productivity and poor quality of life. So behavioral effects, especially in children, ADHD-like symptoms, because the child is not oriented, the child will be having a poor school performance and learning difficulties, memory, cognitive effects, and problem-solving skills. The children will have enuresis as a problem because your immune system, if dysregulated due to inadequate sleep, can lead to inflammatory markers being high, so enuresis will be high. Craniofacial development concerns need to be addressed and decreased quality of life for the children. So even elevated blood pressure in children needs to be documented. Ripple effect on the skin. So this factor we commonly leave it saying like it's because of metabolic syndrome. That may not be the case because chronic OSA can lead to chronic hypoxia, leading to skin disorders also. So the alarming one is hypoxia-related skin cancer, especially melanoma, which is increasing in prevalence in our country because of everyday activities. So ripple effect on autoimmune system. So this particular thing, see, we very often don't ask our rheumatology colleagues to look into it because we say it's because of inflammation. Let the patient get addressed with proper sleep and eating habits. So that may not be the case. OSA can flare autoimmune disorders. So an unchecked or subtle autoimmune disorders can flare if you have severe OSA. So the predominant one is rheumatoid arthritis, ankylosing spondylosis, inflammatory myopathies, and Sjogren syndrome. So ripple effect on the eye. This is basically because of the oxidative stress which has an oxidative stress, inflammation and sympathetic activity, leading to glaucoma, floppy eye syndrome, and retinal vascular changes, primarily due to metabolic syndrome and hypertension. So ripple effect on the gut. So we have the gut-brain axis, which normally don't have an direct effect, but has a microbial effect on the gut. So if you have a normal flora in the gut, so you'll have a normal somnolence. So GERD and liver fibrosis, these are the common factors which can get developed because of inadequate sleep. So ripple effect on urological disorders and nephrological disorders. So you will have altered sexual function, and urinary tract symptoms, BPH and chronic prostatitis might increase, and you have nocturia leading to chronic kidney disease. Urinary parameters such as microalbuminuria may be there and increase urinary concentration of metabolites of catamaline. So ripple effect on the blood. So sir has talked about increased pro-inflammatory markers. So that is thing, and ripple effect on anesthesia. So whenever you take a known case of OSA for any surgery, so you'll have to think about mandible, oral cavity, intraoperatively respiratory depression, and post-operatively the airway compromise, hypotonia of the lower esophageal sphincter, aspiration. Extubation is recommended only when the patient is completely awake. So two specific categories, that is a ripple on pregnancy. So pregnancy PMS and premenstrual dysmorphic syndromes are very common in OSA patients, which can lead to PCOS and which can lead to infertility. So subsequently menopause, there may be increased mood changes, anxiety and depression. So 50% of the women experience snoring during second and third trimesters. OSA in pregnancy can lead to preeclampsia, eclampsia, pulmonary embolism, and cardiomyopathy. So on the infant, you may have small for gestational age infant, which can lead to respiratory distress, prematurity, meconium aspiration, high incidence of NICU admissions, and require resuscitations. So ripple effect on geriatrics. So any person above the age of 65 has a risk factor, and particularly with a known cardiovascular disease. So here the prevalence is mostly central origin, and CPAP is the commonly recommended option. So on health administration. So OSAs, not many insurance cover, so it's a burden on the society. And another thing is husband and wife relationship in OSA. So this thing has been covered a lot in newspapers and social medias. Husband snores or the wife snores, the bed partner suffers a lot. So the common diagnostic method is polysomnography, home sleep apnea testing, and screening with Epworth scale and stop bank scoring. So management, CPAP is mainstay, oral appliances, weight loss, lifestyle changes, and surgical options, which we are here to discuss about. And the take-home message is OSA is a multi-system disorder. Early diagnosis and treatment is must to prevent complications, and collaboration across specialties is essential.
You said something about husband-wife problem. Husband-wife problem. See, it is mirroring obesity. If wife is obese, husband also becomes obese.
Husband or wife, both can snore.
Both can snore. Both will snore, so there will be no problem at all.
Sir, how can it not be a problem, sir? It will disturb each other's cycle, no?
Okay, Malar did DLO in MMC and MSc at Stanley Medical College. So one request is share the PPT.
Sure,
we have a lot of postgraduates.
Definitely.
Very nice.
Thank you, ma'am.